I'm Dr. Leela Mohan. I'm an MD physician. I practice diabetes. I have my own center in HSR Bangalore that is called as Padithem Healthcare. And then I'm consultant in motherhood and Columbia Asia on Sarjapur Road. So long COVID is nothing but a person will develop symptoms. Once they affect with the COVID, there are certain symptoms which will be like easy fatigability, loss of appetite and decreased hungerness, and then hair loss are the certain symptoms which will be developing in the long COVID. And then there are certain things when we compared with the diabetes, and people who don't have diabetes and all, they had developed the diabetes. This is also one of the long-term complication of the COVID. So easy fatigability is one of the main reason where the person cannot do their regular activities properly, and that is also one of the major complication of the COVID. And certain things called as mild cough or sore throat or little headaches which will be pertaining for the months together, that is also a complication for the COVID. So when certain things are there, when you are having dry cough which is pertaining for the long time, 3 to 4 months, where it is not reducing with the drugs or with the natural remedies, like where you'll use the turmeric milk at home or drinking hot water or salt water gargling, all certain things when you do also, if still there are things which is not reducing, we have to get it checked with the doctor. And there are certain blood tests which are called as the CRP, IgE levels, D-dimer and Serum Ferritin, LDH and all the other things which has to be checked very frequently, which definitely will help you in are you really suffering with the COVID complications or not. If it is required, your physician will suggest for a CT chest, you can just get it done that also. Because of the COVID, certain things called as fibrosis which will develop in the lung fields, so which also causes shortness of breath and mild anxiety and little headaches. These are the certain symptoms which you have to notice in the long-term complications of the COVID. RTPCR will be always negative, so it doesn't mean that you have COVID or you don't have COVID. Usually once a person is taking the vaccination, which are double dose, and now we are giving the third booster dose also, they will be developing the enormous antibodies which will be in thousands. So that doesn't mean that the person is not suffering with the COVID. So once the COVID, if it is again attacking the person as a virus, so definitely your RT-PCR may show positive, and negative doesn't mean that you don't have COVID. And always you should be watch out for the complications, which as already I had mentioned what are the main complications. So we have to look very seriously into these complications.